So degenerative spine is just part of our aging process. And essentially, it's similar to developing wrinkles or gray hair. As much as we don't like having them, unfortunately, it's the natural order of things. So, and so it essentially just means age-related changes. Now, this can affect the discs, it can affect the facet joints, the ligaments, the muscles, etc. And essentially, it can cause a whole range of problems, ranging from back pain to sciatica type pain or any such symptoms relating to nerve root compression, as well as deformity. But ultimately, the outcome of that is that it affects an individual's quality of life, comfort, and ability to function normally. So surgery is not always necessary. Some patients can manage their symptoms quite effectively by a good rehabilitation regime, exercises, as well as pain management. However, essentially surgery becomes necessary when, despite these methods, that patients' quality of life, comfort, and function is still affected by pain. So that's the only absolute need for surgical intervention. So that's the only need or relative need for surgical intervention. There's no absolute need for it. And what's really important is if we're considering surgery, to ensure that there's a clear surgical target which explains the patient's symptoms. So essentially, this depends on the symptoms and the underlying pathology and the impact that this has on the patient's life. Now, not all degenerative spinal disorders are the same, and some require relatively simple procedures. For example, a disc prolapse, the natural history is very favorable, with 90% of symptoms resolving by 3 months. So essentially, for such cases where there's a favorable natural history, all that may be required is a nerve root block to facilitate pain management and await the favorable natural history to resolve. However, others do require surgery, which can vary depending on the complexity. And this can be quite straightforward, such as discectomies and decompressions, where we essentially create more space for the nerves in order to relieve the pain associated with those nerves being compressed, to fusion procedures, which are slightly more complicated and involve inserting various hardware within the spine, such as screws and rods. Now, the fusion procedures are indicated in patients who require more radical decompressions, or those that may require, or those that may have deformity, for example, and it requires such correction, or those that have instability in order to prevent or to treat symptoms from instability. Yes, and there's a great focus on more minimally invasive surgery for spinal disorders. And the reason is quite evident from orthopedic principles and the rest of the surgical specialties, whereby by doing minimally invasive surgery, there's less tissue destruction, less pain, early rehabilitation and mobilization with earlier discharge from hospitals. With regards to spine surgery, there's a great focus now and a move to endoscopic spine surgery for decompressions and discectomies. And for the fusion procedures, this can also be performed minimally invasively, either via the use of X-rays to facilitate our screw position or even navigation. And the results are quite favorable. So I think when there's a clear identifiable surgical target which is responsible for patient symptoms, which is also corroborated on the specialized imaging such as an MRI scan or X-rays, the surgery is very successful, especially at improving symptoms of nerve root compression, that is sciatic and nerve root type pain, which may be radiating down the legs. In terms of surgical success for back pain, again, it's really important that the source of back pain is clearly identified. And the reason is because MRI scan findings are quite prevalent in individuals from the population who are asymptomatic. So therefore, what is really important before embarking on spinal surgery, especially for back pain, to have a clear pain target and a pain source, which if treated correctly would help improve patient symptoms. So if a surgical target is clearly identified and corroborates with patient symptoms, then in my opinion, surgery is very successful. Surgery is not so successful when a clear pain source is not identified, and in such cases, the outcomes can be unpredictable. In my practice, I don't brace patients with a degenerative spinal treatment or surgery for degenerative spinal disorders. But however, in some cases, it may be beneficial. For example, patients who've had long posterior decompressions, just partly for pain relief and partly to allow the spine to get used to its position and prevent further deformity. So in my practice, very rarely do I brace patients after degenerative spinal surgery.